Did you know reducing dietary salt can be as effective as taking medication for lowering blood pressure? High blood pressure is the most common chronic disease in the world. According to an article in the Journal of the American Medical Association, November 11, 2023 issue, research showed a low-sodium diet, 500 mg daily, lowered systolic blood pressure by 7 and 8 mmHg in nearly 75% of study participants. These results are similar to results from first-line medications used to treat patients with high blood pressure. This video will present how much salt limitation is needed to lower blood pressure and ways to limit salt in meals and still have tasty food. Ways to cut salt in your diet. When buying packaged foods, look at the nutrition facts label on the packaging and try not to buy foods with more than 250 mg of sodium per serving. Be cognizant of how many servings you eat of a packaged food in order to not exceed total of 1,500 mg sodium per day. The American Heart Association states Americans on average consume 3,400 mg of sodium per day. The American Heart Association and the World Health Organization recommend limiting sodium intake to no more than 1,500 mg sodium per day. Use herbs, spices, and citrus to increase flavor of meals. Make sure there's no added salt in the spice or herb mixtures. Use the following to enhance the taste and nutrition of meals: garlic, onion, cayenne, cumin, basil, coriander, thyme, curry, turmeric, lemon, lime, etc. Consider using salt substitutes containing potassium chloride instead of sodium chloride. According to the American Heart Association, 9 out of 10 Americans consume too much sodium, and more than 70% of that sodium comes from processed and restaurant foods. Our body needs only about 500 mg sodium per day, which is equivalent to only 1/4 of a teaspoon of salt per day. So 1,500 mg sodium per day is more than ample dietary sodium for most adults, unless they are competitive athletes or other persons with environmental or health factors causing them to lose more sodium in sweat or urine than usual. Remember, reducing salt in meals can really be effective in lowering blood pressure. So aim for consuming no more than 2/3 of a teaspoon of salt per day, which is equivalent to approximately 1,500 mg per 1.5 grams of sodium per day. Cheers to your living a healthy life. This video is for educational purposes only, not to diagnose or treat any particular individual. Consult an appropriate healthcare provider for your individual situation.